Welcome to this short course about intimate partner violence. I am Azucena Ugarte, Director of the Office of Domestic Violence Strategies. My co-worker Liz Pride and I will be doing short courses related to the topic of intimate partner violence. This is the introductory course, or as we call it, IPV 101. By the end of this training, you will be able to define intimate partner violence, recognize different types of abuse, and identify strategies to support survivors. IPV is common, could happen to anyone, and it could impact the physical, emotional, and psychological well-being of survivors and their children. This training will help you recognize the dynamics of IPV and provide support and referrals. So, what is intimate partner violence, or IPV? It is a pattern of behavior that allows one partner or ex-partner to gain and maintain power and control over the other person. According to the Centers for Disease Control and Prevention, 1 in 4 women and 1 in 10 men have experienced physical abuse, sexual violence, or stalking perpetrated by a partner or ex-partner in their lifetime. It happens to all communities, regardless of ethnicity or race, socioeconomic status, religion or gender identity, sexual orientation, or immigration status. It is lethal, that means dangerous, fatal, especially for women. In the United States, depending on the study, close to or over 50% of female homicides victims are murdered by former or current intimate partners, and women are nearly 6 times more likely than men to be killed by intimate partners. When people hear about domestic violence or intimate partner violence, they usually think of physical abuse. However, abusive partners use different types of abuse to obtain and maintain power and control over the other person. There is physical and sexual abuse, psychological or verbal, sometimes also called mental abuse, financial or economic abuse, and stalking. Some examples of physical abuse are the obvious ones, like hitting, but there are also other ones that may not be so obvious, like preventing partners from accessing healthcare or controlling the partner's medication. Psychological or verbal abuse includes behaviors like putting downs and constant criticism, isolating the partner from friends and family, extreme jealousy, monitoring partner social media, and controlling how partners should dress or what activities should partner do. Financial abuse could be controlling partners' money, sabotaging or interfering with partners' employment or studies, not paying bills that are on partner's name, or having property only being on the abusive partner's name. Stalking is a pattern of behavior directed to a specific person that would make a reasonable person be in fear or substantial emotional distress. In the case of stalking, it is not about the behavior, but what that behavior means to the survivor. For example, receiving a gift or a card from an ex-partner may not be intrinsically threatening, maybe even nice. But if someone had been trying to hide from that ex-partner, that gift or card means I found you and you cannot get away from me, which is very scary. These are just some examples of abusive behaviors. It is important to understand that an abusive partner may be using a combination of tactics to maintain this power and control, and that these abusive behaviors impact survivors' decision-making about staying or leaving the relationship. It is also important to be aware that abusive relationships don't happen in a vacuum, but in the context of a society in which there is sexism, racism, and other types of oppression, which also impact survivors' decision-making and expectations for abusers' accountability. For our work, it is important to differentiate between conflictive or bad relationships and relationships that are abusive. We know that the relationships are very complex, but one easy way to explain the difference is that in relationships that are bad or conflictive but are not abusive, The two partners may argue, even be aggressive to each other, but they both have equal power in the relationship. In that type of situations, talking to the two partners or doing couple counseling or therapy could be an option, or breaking up could also be a safe option. In the case of abusive relationships or IPV, what we have is a dynamic in which one partner has power and control over the other partner. Given that dynamic, couple counseling will not work because the person being abused or controlled may not feel safe to share with the counselor about what is happening in the relationship when the abusive partner is sitting right next to them. And the abusive partner may try to actually manipulate the sessions. Likewise, in the case of abusive relationships, ending the relationship is not that easy, especially if there has been financial abuse and isolation. It is also important to note that ending the relationship does not end the abuse, and that abusive partners usually escalate their behavior when the survivor tries to end or leave the relationship. Be careful about having these conversations in privacy. Be clear about what you can and cannot keep confidential, and be careful about how you document IPV and who will have access to that information. In the case of IPV, confidentiality equals safety, and we must always take into consideration if the abusive partner will have access to the information that the survivor is sharing with you and how that information could be used. If you are working with a family or the couple, once again, be careful about what conversations are safe enough to have with the two of them and which conversations should be done separately because they could expose survivor to further abuse or escalate abusive behavior from partner. If you are not sure, check with the survivor about it. When someone discloses IPV, it could feel overwhelming for the provider from the practitioner, and we could get anxious about our response. These are examples of language you can use in your interaction with survivors. Thank you for sharing your story. I'm sorry this is happening to you. I want to let you know that this is not your fault. What do you need? How can our program support you? There are domestic violence programs with free and confidential services. Would you like to talk to a domestic violence advocate? Do you want us to call the first time together? Do you want to explore your legal options? Be careful about having these conversations in privacy. Be clear about what you can and cannot keep confidential, and be careful about how you document IPV and who will have access to that information. In the case of IPV, confidentiality equals safety, and we must always take into consideration if the abusive partner will have access to the information that the survivor is sharing with you and how that information could be used. If you are working with a family or the couple, once again, be careful about what conversations are safe enough to have with the two of them and which conversations should be done separately because they could expose survivor to further abuse or escalate abusive behavior from partner. If you are not sure, check with the survivor about it. We recommend you get familiar with the services specific to IPV survivors. For example, there is a domestic violence hotline that operates 24/7 and uses Language Line to interpret to languages other than English. The domestic violence hotline is the intake for the 2 domestic violence shelters in Philadelphia and the first stop to learn about services like empowerment counseling. There is also free legal services through the Women Against Abuse Legal Center. These are services for protection from abuse order cases and child support and custody related to IPV. All these services are free, confidential, and they are provided regardless of immigration status. Thank you for taking this introductory course to intimate partner violence. Please complete the brief survey and contact us directly if you have any questions about this topic.